Hey, everybody. Welcome back to Fugitive Facts, the podcast where we uncover the most intriguing and unexpected truths. Today, we're going to jump into a topic that's crucial, yet often overlooked: navigating the healthcare maze. We'll uncover some surprising facts about what you should expect from your primary care doctors and shed light on lesser-known issues that can arise. Let's get started. First up, let's talk about making an appointment. As we age, regular checkups become more important. But have you noticed how tough it can be just to book an appointment? You might call and be put on hold forever. Or worse, you might find out the next available slot is weeks away. It can feel like you're constantly playing phone tag with the receptionist. I know, frustrating, right? Here's a surprising fact. Many healthcare systems are overwhelmed and appointment slots fill up fast. But here's a tip. Try booking your next appointment before you leave the doctor's office. This can save you a lot of hassle later on. Also, don't hesitate to ask if there's a cancellation list you can be added to for an earlier slot. Some offices also offer online scheduling, which can be a quicker way to snag an appointment without waiting on hold. Keeping a consistent schedule and planning ahead can make this process a bit smoother. Now let's talk about the actual visit. You finally get into the doctor's office after weeks of waiting, and before you know it, the doctor is in and out, barely giving you a chance to ask questions. It can feel like they're more focused on getting to the next patient than addressing your concerns. It feels like a whirlwind, and you're left with more questions than answer. Here's a truth many don't realize. Doctors often have only 15 minutes per patient due to overloaded schedules. Remember, it's your right to have a thorough consultation. Make a list of your questions beforehand and don't be afraid to speak up. If you feel rushed, politely ask for a few more minutes or see if you can schedule a follow-up call. Also, consider bringing someone with you to your appointments. A friend or family member can help take notes, remind you of questions you wanted to ask, and ensure that you understand everything that was discussed. Advocating for yourself is crucial. Don't leave the doctor's office until you feel satisfied with the answers and information you've received. Another critical aspect is discussing medication side effects. Often doctors don't bring this up unless you ask. They might assume you don't need to know, or it might simply slip their mind during a busy day. Understanding potential side effects is essential for managing your health. Here's a fact that might surprise you. Not all doctors are thorough about discussing side effects, expecting patients to read the fine print. Make sure you ask about the side effects of any new medication. Knowing what to expect can prevent unwanted surprises and help you make informed decisions about your treatment. Don't hesitate to bring a notepad or have someone with you to take notes during your visit. It's also helpful to keep a medication journal. Write down how you feel after taking new medications, any side effects you notice, and how these medications interact with your other treatments. This journal can be a valuable tool during your follow-up appointments, helping your doctor make better informed decisions about your care. Speaking of medications, let's talk about affordability. It's one thing to get prescribed the right medication, but it's another to actually afford it. Often, doctors don't discuss whether your prescribed medications are covered by your insurance or what the out-of-pocket costs might be. Here's a surprising fact. Many patients don't find out about the cost of their medications until they're at the pharmacy counter. Make sure you ask about the cost of any new medications. Understanding your insurance coverage and knowing about less expensive alternatives can save you a lot of money and stress. Don't be afraid to ask your doctor if there are generic options available or if they can provide samples while you sort out your coverage. You can also speak with your pharmacist. They often have valuable insights on cost-saving options and insurance coverage. Listen, good primary care doctors should offer various options for your treatment. It's not just about medication. Lifestyle changes, physical therapy, and alternative treatments can be just as important. Here's something you might not know. Doctors often have multiple treatment options, but they might only mention the most common ones. Don't be afraid to ask about all your options. Sometimes the best solution isn't the one that comes in a bottle. For instance, managing chronic pain might include physical therapy or acupuncture, in addition to or instead of pain medications. And remember, it's okay to seek a second opinion if you're unsure about the recommended treatment. When you explore different treatment options, you're taking an active role in your health care. Ask your doctor to explain the pros and cons of each option, how they work, and what you realistically can expect. This can help you make a decision that aligns with your preferences and lifestyle. Also, look for resources in your community, support groups, educational workshops, and wellness programs can offer additional support and information. Lastly, let's talk about scare tactics. Unfortunately, some doctors use fear to push you into a particular treatment plan. They might emphasize the worst case scenario to get you to agree to a specific procedure or medication. Now, this can be very distressing and counterproductive. Here's a startling fact. Fear-based tactics can lead to rushed decisions and unnecessary treatments. It's crucial to have a doctor who communicates clearly and calmly without resorting to fear. If you ever feel scared or pressured, it's okay to take a step back. Ask for more information or even consider finding a new doctor who respects your need for calm, informed decision-making. Make sure to ask your doctor to explain your condition and treatment options in a balanced way, highlighting both the risks and the benefits. If a doctor is using scare tactics, it can be helpful to get a second opinion to ensure you're getting a well-rounded perspective. Your healthcare decisions should be based on facts and thoughtful consideration, not fear. Now, before you leave your doctor's office, there are a few more things that should be done. First, your doctor should provide a summary of the visit. This includes a recap of what was discussed, any diagnosis is made, and the treatments or medications prescribed. Second, confirm the next steps, whether it's scheduling a follow-up appointment, getting lab tests done, or starting a new medication. Make sure you know what you need to do next. Ask for written instructions if needed. Third, make sure you understand your treatment plan. Ask your doctor to explain it in simple terms and verify that you know how to take any new medications or follow through with recommended treatments. Lastly, discuss any follow-up appointments or tests. Make sure you know when you need to come back and what to do if you have questions or experience issues before your next visit. Having a clear plan can help you feel more confident and less anxious about your health care. I know navigating the healthcare maze can be challenging, but understanding what to expect from your primary care doctor can make a big difference. Remember, you deserve to be treated with respect and given all the information you need to make the best decisions for your health. So thanks for joining us on this episode of Fugitive Facts. If you found this helpful, please share it with your friends and family. Don't forget to subscribe for more insightful episodes. Stay curious, stay informed, and keep seeking the truth. Your health may depend upon it.